Bun găsit, prieteni, eu sunt Tudor Curtifan, suntem în cadrul interviurilor noastre DC News, DC News TV, DC Medical. Dedicăm această ediție unui proiect major în domeniul sănătății. Peste 11.000 de români din mediul rural vor beneficia de screening pentru diabet, screening gratuit pentru diabet. Vom discuta despre implicarea sau despre dezvoltarea acestui program generat de compania Boehringer Ingelheim. Vom discuta despre modalitatea în care se desfășoară programul, provocările pe care le întâmpină, ce rezultate avem și care sunt următorii pași. Alături de mine în studiourile noastre se află doamna Vasiliki Tsakkaraki, General Manager Boehringer Ingelheim. Ms. Tsakkaraki, hello. Thank you for joining our program. It's a pleasure and an honor to have you here, and thank you for accepting our invitation.
Hello, thank you for having me here.
So, how did you come to found the diabetes screening project in Romania? And I know you have a very good collaboration with Caravana cu Medici, which is a very important ONG in Romania. If you can tell us about this story.
Yeah, sure. Today is the World Diabetes Day.
Exactly.
It's a very good day to speak about this screening program. Actually, we have a seeding fund from Boehringer Ingelheim that was granted to Caravana cu Medici about screening for diabetes in the rural areas in Romania. So how we came to that is that Romania is a very well progressing country in the healthcare sector. However, in many areas in Romania, there are still very high unmet needs. So in the rural areas, there are patients, actually individuals, that they don't have access to healthcare. And this is because either there is no healthcare infrastructure, or because their patients, they don't have the right education to go early enough to do checkups and to take care of their health on time. And we want with this project to change that. Actually, we want to give hope to the patients for better lives. We want to give hope to the communities and their families that they can live healthier together. And we don't want to have just once-off intervention. We want to make a sustainability program out of that. And this fits really nicely with the Sustainable Development for Generation program of Boehringer Ingelheim.
Exactly. Speaking about this program, you mentioned Sustainable Development for Generation, SD4G. Can you tell us, please, more about this program?
Yes. So the SD4G, Sustainable Development for Generation, is the sustainability strategy from Boehringer Ingelheim to create a long-term impact for people, for communities, and for the planet. So we have three pillars. One pillar is the more health. Second pillar is the more green. And third pillar is the more potential. This program with a screening of diabetes in Romania so that we can prevent complications from the heart and the kidney belongs to the more health pillar. What Boehringer wants to do is that wants to expand the healthcare access for more than 50 million patients. And we invest 35 billion in health innovation to tackle non-communicable diseases. So it is the screening programs, they help so that we identify the diseases early, so that we have a focus on the prevention rather than to treat expensive complications in the future.
Yeah, but Romania, I know, is the first country to receive funding in this program, in your program. And my question is, why Romania? Why?
Yeah, this is a very good question. Actually, we are very proud in Romania to receive this seeding fund for Caravana cu Medici. This is based on many reasons that make Romania an attractive country and a pioneer in Europe to receive this seeding fund. I would say there are four reasons. The first reason is the real medical need. We have health care gaps in Romania. As we said, in rural areas there is this big lack of healthcare infrastructure. The patients, especially the patients in rural areas, that they lack education or they lack the culture of prevention. They do not access for regular health checkups to the physicians. And actually this aligns with our SD4G mission to expand health to those that they do not have access to healthcare system. That was one reason, the real medical need. The second reason is that it looks like Romanian governments have demonstrated openness for collaborations with the concept of private public funding. The third is the scalability opportunity and the regional influence. So Romania can be a pioneer country, and if this program from Caravana cu Medici runs well and brings value to the Romanian rural areas, to the communities, then this can be expanded in Central and Eastern Europe. And the fourth and the most important reason why we selected Romania is that Romania is very advanced in the framework for mobile health. Mm-hmm. Because of the lack of infrastructure, several governments and healthcare agents in the past, they came with a legislation to support mobile health to cover for the gaps in the healthcare. And also in this government, the current government, they support even more the mobile health. And what we wanted to do with Caravana cu Medici is that the NGO, with a grant, they will support the intention of the government to support the rural areas, so that especially for diabetes, we can have an early diagnosis and we can prevent very severe complications from cardio and renal systems. One reason that came afterwards, and the last one, is the Caravana cu Medici themselves. So this is a very distinguished NGO. They are awarded in the European level for their contribution to mobile health in Romania as pioneers, and before any other country got awarded. And they have a passion and determination to serve the rural areas. They run more than 200 caravans with different diseases so far, and we had the right partner. We have the right openness in the country and the huge medical needs, so this is why Romania was awarded with a grant.
Indeed, Caravana cu Medici, it's a very important non-governmental organization, and they are doing a very good job. As you do, of course. But let's talk about those caravans. And I would like to ask you, how do you help the patients in the countrysides, in the rural areas, to be informed about the program, about the testing? Because I think it's a challenge in this way. Yes.
Caravana cu Medici, when they receive the grant, they are the only responsible agent to carry and implement this very important program. And they have the right channels to communicate to different communities. So their expertise to connect with the local municipalities and the local communities is the right channel to inform the individuals in the community. So how they do it, they use social media, they are using direct communication with the municipalities, okay. And the most important is that they motivate and they inspire the municipalities to go to talk to the communities, so that the communities in the end, they understand the why they need to come to this screening program, and also to understand what is going to happen there. And only with the transparency and the communication, the individuals of the communities, they feel comfortable, and then they are more familiar, and they come to participate to the screening. In the end, it is the the individuals that they decide for themselves. Nobody can force them to come to the screening.
Of course. But how do you select the patients? Because there are some criteria, age, or I don't know, or social status or something like that.
Yeah, this is for us, since this is a sustainability program and not so much of a research program, we are rather the criteria is to be the most inclusive possible. What does this mean? It means like the invitation is open to every individual in the rural areas, in the communities. We select based on social and geographic criteria where the Caravana cu Medici will go. So Caravana cu Medici have their own contacts and they go where the most need is. So they go more to those that they are most probable that they will never end with a proper prevention health strategy. And when they arrive there in these communities with the most need, all individuals are invited. However, there are some screening questionnaires that they are used. And so that we make the best out of the seeding fund, we are screening the individuals that they are at most risk. And it depends on those patients that they have a risk and willingness to participate, and this is how we, Caravana cu Medici, select in the end the population to be actually screened.
It's a smart choice because age is not a good criteria because many youngsters, I saw many youngsters who have been found with diabetes, so it's an...
This is true. This is
said.
Really true, and this is why many people, they live silently with diabetes for many years, and they do not find out that they are suffering from the disease until the first complications come, and then it is rather late to live a healthier life, and that's why the screening program is so important and independent of the age.
Exactly. So, from a medical perspective, Ms. Sakaraki, what type of specialists are take part at those caravans, and how the process works?
The Caravana cu Medici has a very well-defined process. And how they run the project is that they have, first of all, 7 branches in Romania, and they have 7 mobile units, caravans. And those caravans, they look like a small, well-organized clinic. So they have from volunteers, medical students, to nurses and paramedics, and they have general practitioners, and most important, they have a specialist. In our case, they have diabetologists that they will be the ones that they will actually make all the screening program with the highest medical standards according to the recent guidelines.
What happens after, for example, a patient was found with diabetes? There is an ongoing process after that, monitoring the patient, or?
Yes, so indeed, when a patient with high blood sugar is identified, there is a process according to the guidelines that the diabetologists need to confirm this first time high value of glucose. And then maybe the patient has to come back for a control visit. And then the diagnosis is controlled. So what is really important and what is the core benefit of this program and the key difference from other screening programs that has been done so far is that the patient is registered from Caravana cu Medici in a specific platform. Because as we said, that's not a once-off intervention. It is rather a sustainability program, and we care that the patient has a long-term control of their health issues from diabetes so that we can prevent the complications from the renal and the heart. And the patient is registered in that platform. And afterwards, they get reminders from the system, from Caravana cu Medici, and the patients come back. And when the diagnosis is confirmed, then they come to a discussion with the physicians to receive the appropriate treatment according to the guidelines. What is very important to mention is that we can find patients that they had already diabetes.
Okay.
However, those patients, maybe 10 years ago, they were diagnosed and they were treated with a specific treatment. But maybe now with this caravan, they find out that the disease progressed and they are not anymore in the right treatment. So that's why we need a diabetologist there to assess the situation and the disease stage. And maybe the patient needs to have another treatment according to the guidelines, because nowadays there are treatments that they can prevent the cardio and the renal complications.
Exactly.
And that's the key difference. The key difference is the long-term monitoring of the patient, so that in the end, the patient lives a healthier life.
But they are willing to be tested in the countryside? I mean, they understand the importance of the process?
It is also Caravana cu Medici run with volunteers. We have some information leaflets that they are appropriate for patients in a language that they can understand. And it is very important for us also to establish this culture of accepting to be tested on time. And one needs to understand why this test can prevent worsening of any disease, and only the individuals, not the patients,
Yes.
that in the end they accept to be tested, they can be tested. And these patients, they don't get the benefit only for themselves, but they can be used as advocates in their communities. Mm-hmm. They can influence other people in their communities, and then more people they will be willing to be tested. Mm-hmm. So one patient that is getting tested can be an advocate for us and can be a positive influencer within their own communities to save more lives there.
To save more lives, exactly. Speaking about the caravans, and I would like to ask you about this digital platform that will connect the patients with the caravans, and how this platform works. Maybe you can explain the process.
Yes, so the platform is not something extraordinary, and nowadays
but
we
your
have...
mission is extraordinary.
So for us, the platform is, it works something from the technical perspective like a teleclinic platform. But what brings to us, for us, it is a bridge in between the first time that an individual is diagnosed with diabetes and the future of the healthier life. So the platform that fulfills, of course, all the GDPR standards is very useful for Caravana cu Medici, because this is how we register the patient and we can have an overview of the evolution of the disease. And when a physician, a diabetologist, has the chance to look at the specific patient that lives in a rural area, can send messages for control visits. They can contact the patient digitally. Otherwise, the patient that lives kilometers away from a healthcare infrastructure would never be able to have control visits. So the platform is the bridge from today to the sustainability and the long-term impact to the patient and further to the health of the communities.
So if this program will be a success, and I bet has already been a success program, do you plan to expand the program to another region? You already answered this question because you said it is a plan to expand the program in other regions of Europe. So Romania can work as an icebreaker for this screening test program.
Yes, sure, absolutely. And this is like the beauty of this program, that is scalable. So we are sure that it will be a huge success because it brings only value to communities that they don't have access to health. It aligns perfectly with our SD4G program at Boehringer that we want to expand access to health. Everybody from us, we have the right to have access to health, and what this program will bring Romania as an example to expand access to health, especially for diabetes. Diabetes is one of the non-communicable diseases, and those are diseases that can be prevented, and is a benefit not only for the patient that will have a healthier life, but also for the government, for the healthcare system, because we can prevent waste of budget that would be used to treat these very expensive complications in the future. I believe when other countries, they look the success of Romanians program with Caravana cu Medici, they will definitely be happy to implement. And our region, the regional center in Vienna, where Romania belongs, has more than 20 countries under their leadership, and Vienna can be the coordinating factor to expand the program from Romania to the entire region.
I think you have the support not only of government but of local authorities, because I think it's a win-win situation even for local authorities to support your initiative.
This is the most important thing for sustainability is the partnerships. So the partnerships, and Caravana cu Medici, as we said, one of the reasons why we trusted them, the grant, is Caravana cu Medici already, they have very strong partnerships with healthcare sector stakeholders, with diagnostic companies stakeholder, with other pharmaceutical companies, because all we are in the same battle to prevent the diseases, and for us especially diabetes and the complications. We will look with Caravana cu Medici how we can support local authority partnership, funds that they will come from the healthcare, from the government, because government, they have a self-interest to support the rural areas. So at the moment, this is only a seeding fund to show how for the next 15 months, we are going to screen 11,000 patients. And we hope that from this we can identify at least 10 to 11% of patients that they have diabetes. And thereon, we need to make sure with the right advocacy that the government, they take it up, and this will be continued in the long run, so that more patients, they get benefit out of this.
How do you measure the success of your program? I mean, through the number of diagnoses of diabetes, or through the changes in communities? Because speaking about changes, I think to change a pattern is the most difficult thing, and you need a lot of work and you need years for that, to do that. But you're doing the right and first steps in that way.
Yes, it is very important to change the mindset.
Exactly, the mindset.
The mindset and the culture. But of course, we measure quantitative and qualitative. We need to have some structure in the screening program, so that we make sure that we are in the right track and we use the funds to the right direction. What does this mean? It means that we want, as said, to screen in the next 15 months 11,000 patients in the rural areas in Romania. And from those 11,000 patients, we know the epidemiology in Romania is around 11.6% for diabetes. So we expect to find diabetic patients that they did not know that they suffer from diabetes, but also we might find diabetic patients that they are not in the appropriate treatment to be saved from future complications. And we will register not only the screened patients, the diagnosed patients, but most importantly, the patients that they come back for the control visit. What we said before, this platform that is the bridge to the long-term sustainable benefit, this will be also captured as a measure of success. And we will also measure the patients that they will be willing to come back in not in one control visit, but in several control visits. But this is more the technical way to measure. The most important way, and what is our vision and what is our inspiration, is to see the change of the mindset and the culture in their community. What does this mean is through this educational program in the community, we want to see that the community has a more open mindset towards doing regular checkups, towards leveraging all the opportunities for free testing or from government supporting checkups, because the government here is doing a really good job in Romania. So all the individuals, they can go to their physician and they can have a once per year checkup that is supported from the government. It is for free. But very few patients, they take the opportunity to use this once per year chance for a better health. So the change in the community will be the long-term sustainable proof that the program really worked.
It's all about prevention, you know, and here we have a lot of things to learn about prevention in our society.
Indeed.
But the caravans will be in all Romanian regions, I mean in all countrysides. So.
Yes, we Caravana cu Medici cover with 7 branches all Romania.
All Romania.
So
they good news for all Romania.
They will go around everywhere in Romania. And we hope that when one region, they see the success, that we will make also, will make sure that Caravana cu Medici communicates in public the success. The regions, they will have some competition, and Caravana cu Medici will be invited from the local communities to go and offer their very important medical services.
Let's have a competition who tests more, who region tests more.
This would be great.
This would be great. Mr. Karaki, thank you for our interview. And at the end, I would like to address you, to have a message for people who haven't seen a doctor for years. And my heart is broken because I have to say a lot of Romanians haven't seen a doctor for a year. And as you said, diabetes is a very tricky disease, you know. And what's your message for those people?
So I have a message that is very close to my heart, because for me, health is the most important asset we have. And everyone has the right to access to health care. Everywhere in Europe, Romanians, they are European citizens, and they have also access to health care. So health is the foundation for prosperity. Without health, we all mind of our business, but with our health, we cannot do anything else. And it's not only for us, it's also for our families, for the ones that depend on us to take care of our health. Without health, we cannot support who we support, our beloved, and we cannot take care of our children's needs now, and we cannot make sure our children's needs in the future. As you said, diabetes often develop silently,
exactly.
And you can suffer many years. So you don't want to see a complication to have a heart failure or to have a kidney failure before you go to see your doctor. If you haven't seen a doctor, you need to take, after you listen to that, the opportunity to go to do a checkup. Most of the times is for free. It's for free. And take the first step today. And it can prevent serious complications for you. Your health is not about you. It's about the people who depend on you. And if you make today the choice, you safeguard your future, your better health, and the prosperity of your family for the future.
Exactly, that's a strong message. Ms. Sakaraki, thank you so much for being here. Congrats again to your company, Boehringer Ingelheim Romania, for this project. It's already been a success, I have to say, and
Thank you.
I'm waiting you to another interview with good news after this project.
With
and,
the results.
With the results, and as you said, this must be just a first step to a long-term collaboration.
Thank you so much for giving me the opportunity.
Thank you so much. Rămâneți pe canalele noastre, numai bine.